All right, good morning, everybody. Thank you for joining us for January 2022 webinar on integrated eligibility system. Today's topic is talking about renewals, and we're calling it a renewals update because we wanted to make sure you have all the current information, dispel any myths, and talk about renewals during this COVID-19 emergency period that we are currently in. We do want to really acknowledge that all this work, everything we do is brought to you by teams of people. None of this is done in a bubble. We work with our processing teams, our operations teams, our policy teams for both MAGI and non-MAGI medical. This is being delivered by the OHA Community Partner Outreach Team, but we work with a whole range of subject matter experts. And the good news is many of them are here to answer your questions today. So I would like to do a few introductions. And I'm going to ask our folks who are staff here to say hello and just tell us what you do. We're going to go alphabetically here. So let's start with Adonal.
Good morning, everyone. My name is Adonal Arrington. I am a Medicaid eligibility policy analyst here with Oregon Health Authority, and I occasionally tag along and help out the CPOP team.
Thank you so much. And Ana Cristina.
Hello, everyone. I am the lead trainer for the CPOP team. So thank you.
And David.
Good morning, this is David Ballantyne. I am part of the CCO operations team, but I tend to be a part of anything that has to do with customer outcomes related to the Oregon Health Plan.
Thank you for being here. And Janelle.
Good morning, I'm Janelle White. I am a Medicaid policy analyst with the non-MAGI programs.
And we'll discuss MAGI versus non-MAGI as a quick review for everybody, just to make sure we're on the same page with that in just a moment. Jessica.
Hello, everyone. My name is Jessica Diaz. I'm the Provider Outreach and Engagement Strategist for the Community Partner Outreach Program.
And Christy.
Good morning. Excuse me. I am Christy Taylor. I'm a medical eligibility policy analyst. Work a lot with helping with operational processes, helping to advise on that, and as well as the application and one system functionality.
Excellent. Thank you all for being here. I'm Deanna Simon. I'm one of your regional outreach coordinators on the Community Partner Outreach Team, CPOP, over at Oregon Health Authority, or OHA. And we, the first thing I want to say, it's not in the slides, but we so appreciate everything that you as community partners do to help Oregonians and applicants and members with their medical coverage. There's a huge, strong team of you out there, and we are honored to support you. And this webinar is one of those ways that we support you. Every month, we bring information about the one system and about our programs to help you serve folks better. So thank you for being here, and thank you for everything you do. We may have other people join us in a few minutes as they are able, and we'll hear from them with the question and answer session. All right, so today we're going to do a quick review of MAGI versus non-MAGI programs and benefits. And we're going to talk about medical renewals, automated renewals versus active renewals. And before we go into that, I just want to clarify some terminology. So externally, with community partners and with members, we talk about automated renewals versus active renewals. But internally, we use different terminology. An automated renewal internally is called a passive renewal. So you might see that terminology on the chart that we uploaded to the handout section today. And we just want to make sure there isn't any confusion about that. We'll also talk about renewal timelines. We'll show renewal paperwork. We'll talk about applicant portal renewals. And mostly today, we're really talking about renewals during COVID-19. And as that changes, as we exit the COVID-19 emergency period, we will be providing more updates. And then Jessica Diaz and I are gonna tag team the content for today. So before I pass it on to her officially, I wanna say, is there anything else that Jessica or anyone on our organizer team wants to say or bring into the space?
I think we're ready to get going.
Terrific. I will drive the slides and let me know what you need, Jessica.
All right. Okay, so we wanted to ground our module today, our webinar, in a little bit of terminology first, just to make sure we're all on the same page about what the different medical programs are. And we're going to divide it today by MAGI and non-MAGI. So when we talk about MAGI medical programs, MAGI means Modified Adjusted Gross Income. And I like to say that's one of those acronyms that doesn't make anything any more clear when you spell it out. But I do want to give you that just in case that's useful. And that's Medicaid programs for adults and children who are up to age 65, not disabled, or are a parent or other caretaker relative. So that is also known sort of sometimes as the Affordable Care Act medical, or sometimes like traditional medical. It's the kind that our community partners have done for quite a while, and it has its own set of rules for eligibility and its own set of things that we need in the application for those medical programs. And then we also have non-MAGI medical programs, which are the ones that have historically been administered through Aging and People with Disabilities, or an area agency on aging. So this is something that's a little newer to our network and ourselves as well. And it's the Medicaid programs for people who are blind, disabled, or over 65 or older. It includes a few different programs. One that you will hear us call OSIP-M, or Oregon Supplemental Income Program Medical, is full OHP benefits. So it's the OHP plus level of benefits that matches what we're used to seeing in MAGI. It just has a different acronym and different eligibility criteria that get us there. And then there is also another group of benefits called Medicare Savings Programs. And those are benefits that only help people who have Medicare pay for some of their Medicare costs. So those are the two groups of non-MAGI medical programs that we just wanted to start saying that, because we are going to talk a little bit about that moving forward. And so another thing I want to clarify is that the one system has something that is a renewal or a redetermination or some sort of check-in that people have to do with our staff, with our systems. And for different types of benefits, that might be called something different. It might have a different timeline. It might have different requirements. So we have the medical programs, both MAGI and non-MAGI. We also have SNAP, food assistance, TANF, cash assistance, and ERDC, which is daycare. All of those different programs have their own sets of rules, their own sets of terminology, and their own timelines and schedules. And also, all of these programs have different COVID-19 related regulations about, what to expect and what might be different than business as usual. With that said, we're only going to talk about medical today because that is what we know and that is what we can do. And so we are bringing up those other programs in one, just so that we know that, yeah, they are there. Just because we're saying something for medical doesn't necessarily mean it's going to be the same information for SNAP. And we're going to dive more into medical. So we are only expecting our certified folks to understand and help with medical renewals, not SNAP redeterminations, not those other programs. If someone comes to you needing help with a non-medical renewal, their best bet is to talk to either someone at their local ODHS office or someone at the statewide One Customer Service Center, which is that 1-800-699-9075 number. And then another reminder that Oregon.benefits email, the one that we use when we are escalating cases, is also open to the public. So they can email Oregon.benefits as well if they need help. And I think I'm handing it back over.
Jessica, this is David. If I could hop in really quick with a question before you do. This question from Patricia, it says the OR supplement is the same as SSI?
Okay, so the OSIP-M, or the, oh gosh, my acronyms. Deanna, can you bring us back to that slide really quickly so I don't butcher that acronym? Oregon Supplemental Income Program Medical. Okay, thank you. So OSIP-M is APD full OHP benefits. I think that it is often associated with Social Security income and especially supplemental security income, because people who are eligible for supplemental security income are considered to be eligible for OSIP-M right off the bat. So they are often used together, but they are different. And just because you qualify for SSI doesn't mean you don't have to also interact with our systems. So it's a really good reminder that there's a lot of different benefits that people will be navigating simultaneously. Supplemental security income is through the Social Security Administration, and it's not something that you can apply through the one system for. But if you are receiving it, that's one of the things you would report through the application process. That was a little convoluted. I hope that helped.
I think it's perfect, Jessica. And for me, the big takeaway is if somebody is on SSI, that supplemental security income, they are assumed eligible for full OHP benefits under the OSIP-M program. And you mentioned that there are lots of different programs and coverages that people are trying to navigate. And that's a great time to remind people that there are actually, I think, about 48 different medical programs that people are automatically applying for when they start an application in the one system, and it screens for whichever ones have the highest benefit first and then moves on. So you don't need to know if somebody's going to be eligible for one or the other. Everybody can apply and should apply in this one place at one.oregon.gov. With a community partner is a great way to do it, and the system itself will figure out what folks are eligible for. All right, and once they are eligible for coverage, they get coverage for a period of time. Typically that's 1 year, and after that year, they need to renew. And so today we are talking about renewals for medical programs, and it is mostly the same for Magi and non-Magi. It's really the same process. I think the difference that we wanted to call out, and it's the same when you're applying for in some ways, is that some non-Magi benefits, those non-Magi benefits again are for individuals who are 65 or older or disabled. Those benefits may require an interview or asset verification in order to complete the renewal. So every time somebody renews, there may be extra steps for them to take in order to complete that renewal and get their benefits for the next upcoming year. And we'll talk about what some of that looks like and what that process looks like for a member and for their community partner. So every year at the year mark, individuals need to renew and let us know whether their information is the same or whether it has changed. And the way we do this is the one system, or OHP, sends a member a case summary that says, this is all the information we have for you, and you need to confirm that that is still accurate. Sometimes they need to take additional action to verify information or report changes. And we'll talk about the fact that members can get two different types of renewals. The first one is called an automated renewal. And there's different ways to think about this, but the way that we're framing it right now is that for automated renewals, one attempts to complete the renewal before reaching out to the member. And for active renewals, one requires a response from the member before the renewal can be completed. But either way, the system is saying, you're at your year mark, you need to confirm that things are either the same or how they have changed. Now, community partners and members can renew in a variety of ways. You can renew for somebody, or they can renew through the applicant portal by looking up their case, and there will be a button that says Renew Now. They can send in the paper forms that they are sent in the mail. They, or you as a community partner, can call the One Customer Service Center, or it can be done at a storefront office. So there are many different doors into the renewal process. The first thing we want to talk about is an automated renewal. So an automated renewal, again, is when one starts the renewal before receiving new information from the member. It automatically goes into renewal mode. And when that happens, a member might get an auto renewal with no additional information needed. So that's no RFI. An RFI is a request for information. And that happens when no conflicting information is found. So the system pings against known records. They don't find any conflicting information between what is known out there and what is present on the case. In that scenario, the renewal approval notice and a case summary are sent, but the member still has a responsibility at that point. Okay? The member still has to look at that and verify that no additional information is needed. And if, in fact, that case summary is still accurate, then they don't have to submit any additional information. But if that case summary is no longer accurate, it is their responsibility to report changes. So there's always something for the member to do, right? They have to look at the case summary and report any changes. Now, some automatic renewals or automated renewals require active verification of that, and that's an auto renewal with an RFI. That happens when the system finds some conflicting information, and therefore the one system says, well, what's out there is different than what is in the case summary, and so we're going to send this case summary to the client, but they still must respond that that is accurate. So if the case summary is accurate, they just need to respond verifying that. And that request for information might be proof of immigration status. Outside of COVID, it might be proof of income, but during COVID, we're not requiring proof of income. But there's some response needed. And of course, if the case summary is no longer accurate, then they must report those changes. So that's what an automated renewal looks like. And before we go into what the screenshots look like for those automated renewal notices, I'd like to pause and see if David has any questions from the questions box we need to address to clarify.
Yeah, there's a couple, thank you. First question is, at this time with COVID protocols in place, if someone receives a letter requiring information for renewal of medical only and does not respond, will that result in cancellation of benefits?
Thank you. We do go over that later in this presentation, which you didn't know, but the answer is no. Right now, at this time, during the COVID public health emergency, we are not closing benefits due to non-response to a renewal. And yet, people still must renew. They must take action if they get this renewal with RFI to confirm that their case is still accurate. All records need to be kept up to date, even though we are not closing benefits if somebody looks to be over income or if their situation changes.
Perfect, you're good, thank you.
All right, that was a great question. This is what the paperwork looks like if somebody gets an auto renewal. Remember, automatic renewal is how we refer to it externally, but internally, if you're talking to a worker, they might call it a passive renewal. It's the same thing. This is what it looks like, and it has a form number. That's one way you can tell what's happening. So an auto renewal with no RFI, somebody's going to get MED 048. And usually that form number is down at the bottom. I'm having a hard time finding the form number on here right now, so I apologize for that. And it I think it's this, it's highlighted, it's because it's X's. So this will be a MED 048, and this is what it looks like. And it says that medical benefits are approved, and it will ask them to review their their case summary and report any changes. So it says down here on the kind of bottom left, if this information is not right, make sure to let us know. Jessica or anyone else, did you want to add anything else about this form or what individuals might receive?
I think the main thing I take away from the auto renewal paperwork is that almost always the pertinent information is not going to be on the first page. And so that might be something you can help people understand and read through with them, because it can be very confusing.
Thank you.
This is David. There is a classic question from Tina, and maybe this comes up later, but the question is, why does it say coverage ended and then continue for 1 month, then it ended, then ongoing?
That's a great question that we've all been asking ourselves. Maybe somebody from policy can answer that. I do know that we are looking at updating notices because that format has not been something that works very well for members, but maybe policy can speak to why we have that now if you think it's relevant.
I can speak to that really quickly. It's simply because the system determines 1 month at a time, and it could be an indication of a program difference, like we approve one program type for 1 month and a different program type for another. So it just delineates the different program levels we're approving people for. But I agree, that is confusing, and we are looking at updating our notices to be more clear.
Great, thank you. Anything else to chime in before we move on?
Yeah, Jessica asked a question around, will the forms be automatically sent in the client's language, but including some of the more rare languages like Burmese, Karen, things like that.
I can answer that one.
Thank you.
So there are only a few languages that forms will automatically be sent in. I believe it's about 7 or 9 of the most commonly requested ones. So I do not believe they will automatically be sent in languages like the ones, Jessica, that you are pointing out here. I am now going to push it to policy to see, like, is there anything we can say about helping people understand their forms, or to get access to that information in the language of their need?
They can contact the agency if they need their notices translated independently and individually. But you're right, the system does not automatically provide notices in every language that could potentially be out there. We do have like 8 or 9 primary languages that all of our materials are translated into. And it's also, the notices are now also available in your dashboard in English, so that you can also help understand what they're receiving.
Thank you for that reminder. I think there's a couple pieces to pull together here. One is that when a client is asked on their initial application, what language would you like your written communications in? I believe they have a more limited option than their verbal communications. Is that right?
Correct.
And if they select, let's say, Russian in that list, would they then expect their renewal notice to come in Russian?
Yes, all of the written correspondence would then be generated in their written language of preference.
And then the announcement that you just made is that the reminder that as of recently, an English version of that notice will also show in their applicant portal, so they can be helped by community partners or other folks who are helping them.
Yes, that was a recent change that we made.
Yep, thank you for bringing it up. I think it's exciting, and I'm glad we're mentioning it. All right, so now I'm going to move on to the other kind of paperwork. Oh, David, yes?
Sorry, I got one more. Yeah, Matthew asked, is there a timeline of when they should expect this renewal paperwork? A lot of people tend to throw their paperwork out.
Does policy want to speak to that, or would you like me to?
It would be sent 2 months prior to the end of their renewal period.
And the renewal period is typically 1 year after they start their benefits, correct?
Correct, yes.
Yep. Okay, hopefully that answers it, but please feel free to type in more questions about that if you have them. All right, I'm going to move on now to the paperwork people might receive if they have an auto renewal with RFI. it looks a little bit different. It has next steps because they must respond, right? There is a required response to this notice, either to confirm that their case summary is the same or to report changes. It will tell them, as you can see on the right side of the page here, page 2 of this notice, that it will say who needs proof, what kind of proof is needed, and the due date of that proof. And then down below that, under types of documents you can send, it will give them examples of appropriate proof for what is needed. They might need to submit proof of immigration status. That can still happen during COVID. You should not see proof of income needed during COVID, but people might need an interview for non-Magi benefits. So those are the types of things you might see. Right. So are there any other questions about the automated renewals without RFI or with RFI, request for information, before we move on to active renewals?
There was a question that I answered in the chat, but I want to say out loud too, which is, do people get to choose which renewal option they get? And the answer is that the route that people go down is based on the system and based on the information it's able to gather from the databases it looks at. And it is not something that people opt in or out of. It is, we will route them to whatever we can do with the least intervention required of them. And so if it goes to an active renewal, it's because we are unable to do it through the auto renewal process. So I just wanted to clarify that.
Thank you. And that's all to keep with our federal regulations, right? We can't be giving benefits to people who are no longer eligible. So outside of the COVID public health emergency. So we have guidelines about how to make sure we're keeping cases updated so we're not giving benefits where they are not eligible. And it's all to keep with those.
Great point.
Right, we're going to move into active renewals right now, and Jessica will talk about those for a few minutes.
All right. Okay, so for those of you who have been around for quite a while, you may remember a time when everyone had to actively renew. That's sort of how life was for us at OHP until we were able to implement auto renewal, which I do want to I want to make sure I say this again because I'm seeing our policy folks mention it in a background chat, which is that the new requirements are to try to renew everyone through that passive or auto system first. It's only if the auto renewal doesn't work that people would get active. And that is, I know it's a little bit redundant to what Deanna just said, but I think it is important, is that we do try as much as we can to get things to go through without needing the member to actively reach out to us and confirm their information. So you should only see an active renewal if there's something going on that keeps us from being able to go through the auto processes, and it should be fairly rare, although we'll talk a little bit more about what some of those situations are and how it might be a little bit different in the current one system. So with that big caveat up front, an active renewal is when we can't do that auto process, and what it will look like is a renewal packet that has a OHP renewal part 1 and part 2 and a case summary all mailed together. It is more involved than the auto renewal process. It can pretty much look like going through a whole application again because we do have to potentially touch on every part of the application. So this is just a quick note that you may want to book a longer appointment time for an active versus an auto renewal if you see one coming up and you have that appointment scheduling and the ability to adjust your schedules. So how do active renewals work? Just like the auto renewal, there will always be a case summary so people know what information is currently in the system about their case and their household. There will be an active renewal part 1 form that we will look at in a second. And it's a form where so the member must sign it, and there's a signature field on it. And it walks you through whether any changes need to be reported or not. If no changes need to be reported, then part 1 can be sent back and you don't have to look at part 2 or do anything with part 2. But if there's any information on the case that is incorrect, any changes that have happened over the past year, then we need to go on to part 2 as well. And that also has a signature. For both of these signatures, we have clarified that remote signature is allowed and you can help people by signing remotely with their consent. And so the part 2 will go through all of the pieces of the application and ask if there are any changes to every section of the application. And you can either put that in through the paperwork, or you can do that by going into the applicant portal, either the member themselves or the CP if you were associated before the renewal hit, has to be before the renewal started. Then you can use applicant portal and it'll look a lot like reporting a change in applicant portal. You go through every screen and you have to clarify what has changed. And I believe we're looking at the paperwork next. Yes. So here's what part 1 looks like. It'll have a due date on it. It will list out all the household members, and then it asks if the information on the summary is correct, and it'll ask if there are any changes in the household that need to be reported. And then finally, there is a signature field. And so if the information on the summary is incorrect, or if there are any changes that, that someone needs to report, that's when we need to go to part 2, which I believe is the next. Oh, yes. And then I'll pause for questions because I can see things brewing. So the active renewal part 2 is only needed if there are changes, and it is form 7310, and you can find it online. Actually, you can find a blank copy online if you need that. And it goes through everything in the application for each household member, and then it has a signature field at the end as well. And so this is what the renewal part 2 paperwork looks like. And these are just a few samples of it. It's a much longer document than these 3 screenshots.
Jessica, the extra piece that I'd like to add here is that on part 2, people only need to fill out anything that has changed. If things are still the same and consistent with the case summary, they don't need to fill it out again. And it says that somewhere. So I can't see where it says it right now, but that's how part 2 works.
Mm-hmm. Yes, great point. And yeah, I think we're not showing the screenshots of the meat of this, like steps 2 through 6, but it is framed. Most of these are framed as has this changed, has this changed, and if changed, report.
Yep. And the other thing I will add that was in a previous slide, but I think it's worth mentioning here, is that we did get clarification at some point during the public health emergency that this part 2 renewal form and part 1 can be signed remotely during the COVID public health emergency.
Oh, and I see a question that is right in line with what we're talking about, which is if only income has changed, then only the income part needs to be filled out, correct? And yes, exactly. That's exactly the idea.
Yep. Right. This, and Jessica, do you want to talk about renewal in the applicant portal? Or do you want me to pick that?
And I do see we have questions as well.
Yeah, there's a couple here. Yeah, there's a couple here I thought maybe this next section may connect with, but so Vixen asked, so will we be able to see in one that community members are getting their renewal paperwork? We used to be able to search in the applicant portal, it looks like, and be able to figure that out. And then the other question is around this section maybe is for the active renewal. If there are changes, can an assist or assist in updating info through one?
Yeah. Oh, these are perfect to talk about right now. So here's a screenshot of what it looks like. Oh gosh, it keeps changing how it looks. So if someone is in active renewal, and actually I do want to tie in one other question I see in here, which is, does it show up in the system whether it's active or passive renewal? And I think that aligns with what we're talking about too. So this is an example of an active renewal. And if someone is already associated to you in the one system before they go into renewal mode, you should be able to see something like this when you click into their case. And you can absolutely help them by clicking the Start Renewal button on this screen. So that's one way a community partner can help someone. You cannot get associated while a case is in renewal mode. So if you call in to get associated, they're going to have to either work the renewal with you or give you alternatives. So there are some limitations to being able to help people with the renewal in the one system. But as long as you're already associated, you can click through and it's going to look a lot like reporting a change. You're going to go through every screen and you only need to interact with the ones that are changing. Similarly, how can you tell if someone is in an active or an auto renewal in the one system? The first hint is that if it says start renewal, I believe that means it's almost always an active renewal. And you all can correct me if I'm wrong, because the passive renewal or the auto renewal, oh gosh, now I'm mixing my terms. It does all that on the back end and it's done. By the time you go to look at it, it's already out of renewal mode again because now it's pending for an RFI, or now it's just re-upped and it's active again because all of that was done automatically without anyone needing to interact with it. I'm going to pause for policy and make sure, am I speaking out of turn in that if it says start renewal, it's probably active?
That is correct.
Okay, so that's the big hint. And then the other part of it is that when you go and look at the messages, we've been showing you the different documents. So you can guess whether it's an auto or an active renewal based on the documents that populate in the one message center. That's one way. And you can also go and dig up all those documents to see who is auto renewing, who is actively renewing. And if you are in an organization where you have the capacity to reach out to people and proactively say hello and help them through that process, and that's something I highly recommend because it can make the whole process a lot more accessible for Oregonians who maybe threw out their paperwork or didn't understand it or are just really confused about what's needed from them at this point. So you can proactively find that information. It'll be different forms, they'll look different. If it's the auto or the active renewal, they look pretty different. And I think they might even have different titles that show up in the one system, but I haven't looked at it recently.
Well, and Jessica, I'd like to chime in that if I think about myself assisting somebody, I'm not going to get too hung up on whether it's automatic renewal with an RFI or an active renewal. I'm going to go and look at the paperwork that's in their case, and I'm going to see what it tells me to do. And the context that there are these auto renewals or auto renewal with RFI or active renewal helps me understand why different members are getting different actions. But the notices themselves are where I'm going to look to see what needs to be done. And that's really the core of it, is what needs to be done for this member to keep their case updated, which is what they signed to and agreed to with their rights and responsibilities when they apply for medical.
That's a great point. I do also think it's working. I haven't been able to test it recently, but when you go into your dashboard, the search at the bottom has a box that says renews in 45 days. I think that should pick up all of the renewal related activities that need to happen on cases that are associated with your organization. So that's another way to check and see if you have folks who are renewing and who might need additional assistance.
In fact, I will speak transparently and say I wish we had thought of putting that in this webinar. I would like to create an updated version and send it out to everybody afterward that includes a screenshot of what that looks like so people can be reminded that they can do that and see who's coming up for renewal soon and do that proactive outreach.
That's a great idea. Oh gosh, I can't even talk. I am seeing that we are hitting a section of this that people want to hear more about because there's a lot populating in the question box right now. I'm trying to figure out how much we want to dig into it versus we want to finish out and then circle back, because I think these are these are all good, and I want to make sure we get to them.
Yep. I'd say we finish up because there isn't that much more content, and then we come to
Okay.
questions.
Great point. Okay, so everyone, we are seeing your questions. Please continue to put them in, and we are going to circle back to them. We want to make sure we get to as many as possible. All right, do you want to take COVID-19 myth busting?
Absolutely. So this is one of the things that I referred to that I started to refer to in the beginning, and I want to make sure we're saying it more than once, which is that during COVID, we are still doing renewals. It is still a need for federal regulations for all cases to stay up to date. We have this special allowance from the feds to not close benefits, even if somebody comes in as over income with a reported change, for example, or for any other reason that they become ineligible, most other reasons they become ineligible. But that does not change the requirement to keep cases updated. So one of the reasons to do that is that when the emergency period is over, whenever that will be, it's going to be much easier to remedy the system if we have updated cases. And in general, that is what people are, like I said, signing to and agreeing to when they sign their application, is to keep their case updated. Luckily, we don't have to close benefits right now for most of those updates, but those are two separate issues. So we wanted to make sure, but that can get confusing, right? The fact that we're not closing benefits due to non-response to a renewal is a wonky message. So we wanted to make sure to communicate that people still must renew during the COVID-19 emergency period. In fact, renewals have never stopped. They're still occurring on the same timeline, and members still need to follow all the instructions that are provided to them in their renewals, whether it's supplying proof of income or reporting changes or supplying proof of immigration status. That will keep their case updated and keep them in compliance. And they must sign that paperwork when they send it in. The only difference really is that we're just not closing benefits due to most of those changes. Now, as an aside, there are a few changes where we will close benefits if somebody moves out of Oregon, if somebody becomes incarcerated, if somebody passes away, or if somebody requests for their benefits to end. But outside of that, we're not closing benefits. So I hope that explains some of the questions that were in the questions box about why are we even doing renewals or asking for this information if we're not closing benefits. Now, during the COVID-19 emergency period, the major changes, other than we're not closing benefits, is that we are also accepting self-attestation for most eligibility criteria. A big example that many of you are present to is that we are not pending or holding up a case or closing a case for proof of income. Whatever a client puts into their application, we consider that self-attestation. That is what they are testing to for their income, and we're not asking for further proof in order to use that income amount. For those of you who have started assisting during COVID, that's all you know. When the COVID-19 public health emergency period is over, however, you will need to get used to many applicants needing to provide proof of income as part of their application or renewal process. So just a heads up for that. But for right now, we take that self-attestation and we don't require extra proof. And we are continuing to give benefits and coverage even without people responding to a renewal, or even if members report a change that would take them over income, and yet we still require that they keep their case updated. So it's might feel a little bit incongruous, but it's keeping cases updated is our federal requirement. Okay, here's some final notes about renewals. Renewals may look different for different family members because, as a reminder, different folks in a family can have different benefits. One person that's a child might be on the child OHP or the CHIP program, and somebody else in that same family as an adult might be on the adult program, and somebody else who's disabled in that family might be on the non-MAGI OSIP-M OHP. And so the notices that people get can be quite long and confusing because different family members may have different benefits and they may have different next steps. That's why it's important to read the entire notice, because the notice will populate amongst its many pages with instructions for each member. And to make it more confusing, different instructions may have different due dates. Responses about one type of information, people might get 30 days for that, but they might get 45 days for a different type of information. So outside of the COVID-19 emergency period, whatever that due date is, if that date passes without a response, then their benefits will close. During the COVID-19 emergency period, benefits will not close. And it's important to keep in mind that distinction, because eventually we'll go back to the old or the typical way, which is the closing of benefits. So we know that renewals are confusing. The notices can be long, they can be complex, and oftentimes it does take a community partner to help tease that out. So we wanted to thank you immensely for helping your clients and your members understand the renewals, and always reach out to your ROC if you need help doing that and if you need support in that action. And now we can open it up for other questions.
All right. Okay.
Let's see what we've got.
There's a lot of great questions. Let me see here. I did want to talk a little bit out loud about a question about, do we need to get new consents to stay associated to cases as they're going through renewals? Because I think this is a great place to say quickly that our newest consent form, the one that was updated February, just about a year ago, it no longer has a 1-year expiration date. And so as long as you have a version of the consent form that doesn't have that expiration date on it, you don't need to get a new one. But we're right in that time period where you might still be seeing people who have older consent forms on file. And if that's the case, then it's a great opportunity to switch over to the new one that doesn't expire and to get that signature now so you don't have to go chase it later. But as long as you have an active consent form that doesn't have an expiration date, or the expiration date has not yet happened, then you do not need a new consent form. If for some reason someone isn't showing up on in the one system, but you think you should have them, that might be a situation where another organization has gotten a consent form. And that's the only situation I can think of where you'd need a new one. So wanted to do a quick plug for our 6610s.
Go fetch your
also have a great question about saying that people are going through the renewal and then they complete it and the screen does not change. And that is true. I believe the screen doesn't change until the renewal if there's any follow-up pieces that need to be worked, get fully worked. So there may be times where either you see that renewal button persists, or you may even see that it doesn't look like anything changed on the case yet. And that means that a worker has to go do some work on the back end, I believe is the most common scenario there. So I know it's it looks confusing. You're like, I just did the renewal and it still has the renew button. Did it go through? I believe it should have gone through. I also believe you may be able to see a PDF version of the information that you just put into the system under the My Actions in that case. But that if there are situations where you worry that the renewal, frog in my throat, the renewal did not go through, that's a good time to reach out to your ROC and to try to troubleshoot if you think something might have gone wrong on a case.
Yep. I'll chime in on 2 points of that, Jessica. The first one is you referred to finding PDFs of the case summaries in the My Actions tab. And so I wanted to pull up this screenshot of what that looks like and point out that here, right above this yellow, you have a pending renewal, you can see the tabs, and one of them is My Actions, which, oops, I wish I could highlight it, but I can't. But that is where you can look to find those PDFs that Jessica was referring to. The other thing I wanted to mention is that I have now lost it. Jessica, you were talking about why a renewal might still look like it's in renewal mode in the one system when that person has actually already taken action. And the reason is that the renewal is not about so much the client and what the member does, but it's about the system being able to confirm that everything is updated or make those updates in order to give benefits for the next year. And the member has a responsibility in that, which is to provide information. But the renewal is really about the system taking that action. So once the member provides information, they must wait for the system to take that action, and the system completes the renewal. That's one way to think about it, in case that makes it less confusing. All right, let's see what other questions we have.
Let's see here. I do want to, let's see. So there's a question about if people are attesting that they are over income and they sign and that information is in our system, will they have to repay coverage after the emergency period? And I want to say this out loud because I think it's really important to know that as long as people are updating their information and they're doing it timely and they're doing it accurately, any consequences that come out of that, like once we have the information at the agency, that's on us to work it in a way that is going to get to correct information and the correct responses. And, you know, when the time comes for closure, a correct closure. They will not have to repay benefits because by our rules, by our emergency rules, they are eligible even though they went over income. It's not that they are persisting even though they're not eligible. So they should not have consequences. And you can let people know that, like, as long as they are in contact with us, it's okay to go over income. And in fact, we would much rather people report they went over income than try to be quiet about it, because they're going to get the same initial situation and it's going to go so much better for all of us once we do have to make those changes.
Thank you. I see another question here. I'm sorry. For an active renewal, if there are changes, can a sister assist in updating them and updating that information in the One Applicant Portal? Jessica, do you want to take that one, or should we ask somebody who's
Sorry, I was midway through typing out a response to another one.
Okay, so the answer is yes. If, well, unless somebody from policy wants to answer, they might have some more perspective here. For an active renewal, if there are changes, can a sister help report those changes through One? And really, for me, the question is, do they complete the renewal first, or do they report the changes as part of that renewal, and how does that work?
You should be able to complete the renewal and report the changes all at the same time through applicant.
Thank you. And this is also where we have a lot of community partners here who have probably been through this a lot, and you're more familiar with that process certainly than I am. If you would like to chime in and add any input there or advice, please do so, and we can read it out loud. All right, I'm looking for more questions while Jessica's typing.
Yeah, I'm sorry. I got distracted. There's so much good stuff going on. Some of it needs a personal touch, and some of it I think we need to let everyone know.
Yep. I'm sorry, I'm trying to see which one. I'm trying to look for what the ones you have not written an answer to.
I think we do have a couple that fall into this broader category of something weird is happening and I'm having issues completing renewals. And I would say across the board for those is sending cases to your ROC, letting them know what's going on, and they should be able to help you chase whether it's, you know, something in the system isn't working correctly or something in your process isn't going the way you expect. That's what we're here for. So I think we are not able to maybe address all of them out loud here, but that is a category of thing that, like, we're here to do that outside of the webinar, and we really do want to help.
I also want to acknowledge situation that somebody brought up, which is that occasionally they see benefits closing for a member who's removed from a household. And they want to know if a new application needs to be filled out for that person. I don't know the situation specifically, but sometimes somebody may be removed from a household and put onto their own case, in which case they will have a different OHP member number and a different case number. So the benefits from the first case might look closed, and we might need to find that other case to see where their benefits have opened under a different number. So that may be something to think about. Actually, I don't know if their OHP number will change. Policy, can you speak to that? If somebody, for example, somebody who's turning 19, they're being removed from their parents' case or their family's case, and they're now on a case on their own, does their OHP number change? Or does it stay the same?
No, they would keep the same number.
Okay.
Their case number is the part that is, like, I've seen a lot of instances troubleshooting this sort of issue recently where they'll show up on like 3 different cases, but they'll have the same prime number.
Yep. And I think in that case, they will be moving from child benefits to adult benefits if they're still eligible under the adult criteria. And they may get a notice that says that their child benefits have closed. But what should also be in that notice, and sometimes it gets pushed to the next page, is that their adult benefits will be starting. So some of these notices of eligibility can be very confusing because it says that benefits are closing before it says that the new benefits are starting. And that has generated a lot of confusion. That may be something that's going on and you can be looking for. But when you do have that case and somebody does need to be removed from a household and put on their own case, the best way to do that is to work with a worker at the customer service center to make that happen. All right.
And I believe you should be able to, I see a question about removing household members from a case. I believe that should work through applicant portal. If you are having experiences to the contrary, let us know. If someone has already been auto renewed, then that should mean they're in active mode again, and we can treat them just like any other active case and report a change. And if they're in an active renewal, then it would be that start renewal button that can get us to those changes. And I'll add the caveat of if there's anything the one system doesn't let you do, that's a great time to bring in a worker and talk to a human.
And then we've also put out some guidance, Jessica, that I know you're about. At times, we would not want somebody to remove a household member through the applicant portal if they might be on a SNAP case with some of those individuals. So if you're not sure what other benefits somebody has, and if the person you're removing might possibly be on, for example, a SNAP case, then that's where a worker could also be called to make sure it's being handled properly.
Yeah, in any situation where someone was removed from a case but wanted to have their benefits continue, even if they would now be considered over income, I believe that does require a worker taking action. Like the automated processes can't tease out those situations. So that's a great time to involve our processing staff.
We have a couple questions here about a situation where someone's removed from a parent case, for example, a child who's turning 19. They now want to be on their own case. But when they're on their own case, they're going to be over income. During the COVID-19 public health emergency period, would that person keep their coverage even though they're moving to a different case, or lose their coverage because they're over income on their own case? And I'm hoping policy can chime in. I think I know the answer, but I'd like to hear from policy.
I can chime in. This is Christy Taylor. Staff do have a business process to control that. Benefits should not end during the public health emergency. They should transition the person to their new case, but then they need to manually get them approved in the system and get their benefits ongoing again, even if they are over income. I'm not going to tell you that sometimes our staff might miss that step. So if you notice that, please be sure to call our attention to it. You can call them back or ask for a lead or escalate to a ROC. I did see that in chat earlier, and I do think it warrants another reminder to our eligibility staff about that nuance, because that should not be happening. They should not be losing their coverage just for going over income, even if they are moved to a new case.
Thank you. That's important to keep an eye out for, absolutely, because that's where human error can come into play, where it's not just the system making a decision, and to be able to catch that if it happens.
Yeah, and to sort of reiterate that if you go through the system will deny someone if they look like they're new and they didn't have existing benefits. So it really does require a human touch. But it's confusing for, I think there's just so much going on that I am not surprised that sometimes these things do fall through the cracks.
Right. I think from what I can tell, we've addressed the questions in the questions box. So if somebody has a question that they feel was not addressed, either in a written format or verbally, if you can retype it, that would be great. It means we might have missed it.
Oh, I do have one that I see that we responded to in the chat, but I want to say out loud, and I will also apologize if I was maybe typing something in and you did say this, please stop me. But a great point is, like, I get a lot of people that go through the auto renewal process, but they still call because they're confused. And then when I do work with them, it turns out they do have things to report, or they do have things that are worth pursuing. And so that's a great reminder that even if it looks like someone doesn't have to take action, that doesn't mean that they might benefit from having that conversation with you. And that's another reason why we, like, if we're doing things like, if you are a grantee who counts your activities, helping someone understand that nothing needs to be reported, it can be just as intensive as helping someone report a change. So we do want to make sure that you feel like, yes, we are supporting you in doing that work as well, and that is a really valuable role that a community partner can play. And it could be that something comes up that's not even about enrollment, that's about using benefits or connecting to a CCO or a provider. So anytime you have that opportunity to do an extra touch and check in with folks, I think that can be really valuable, especially during the crazy times we've had over the last couple of years. So I did want to give that extra breathing room and put it out loud because I think it's really important.
Absolutely. And some of my community partners are doing a few things to make that happen, Jessica, that I think it's worth sharing. One of them is that they watch their inbox in their one applicant portal for all those notices that come in. So all the copies of clients' notices, of members' notices, come in through the community partner messages inbox. And they have fairly useful subject lines that say things like notice of eligibility or response needed, action needed, or more information needed. They scan those for anything that has an action on it, and they pull them up and they call those folks to make sure those actions are being taken so that their case can stay updated. In addition to that, I have community partners who do the report on everybody coming up for a renewal within the next 45 days. And once or twice a month, they take the time to call folks and say, hi, it looks like you're up for a renewal. Can we review your case information? Make sure you have an opportunity to ask any questions. This is what Jessica was talking about, right? Do you have any other needs? Have you seen a primary care doctor? Whatever the questions are that you would want to ask somebody to make sure they're using their coverage, that's a great time to do it. So I want to put in a plug for using that report to reach out proactively. And if you're a grantee, those calls count in your new applications and renewals, because you are working with folks to make sure they keep their case updated and use their benefits. And if you're not a grantee, it still counts because you're really contributing to people. So we hope that you consider finding the time to do that if you're able.
Let's see, we have a question about, do we know when the public health emergency will end? And we do not. It keeps getting pushed forward so far in our experience, but we will have a lot of training and a lot of information to you once we do get word of changes happening. So I do want to put that out there for all of you who might, like myself, be feeling anxious about that. And there's a lot of really high level, really hard work going on within the agency. No one will just randomly close without us having done a serious amount of outreach and training and other information for you all.
And another note about the public health emergency, it keeps getting extended, I believe, by 90 days at a time or 3 months at a time, and we will get a 60-day heads up when it's going to end. So along with Jessica was saying, it won't happen right away. We will get some leeway there and some notification, so it won't be immediate when it happens. Right now, I believe it has been extended through April.
Yeah, that's the last I heard too.
Before that, if that will be truly happening, or if because we need they're committed, the feds are committed to giving us a 60-day heads up before it ends. Okay,
all right.
Yeah, we're looking at the questions box. It looks like we might have gotten through them all.
Oh, we have a great note from policy that just because the public health emergency ends doesn't mean that immediately there will be things happening to people's benefits. There will be a plan and there will be a timeline, and we will make that clear before it happens.
That's an important note. Thank you, Christy. And thank you, Jessica, for catching that. All right, I see a big comment here that we're going to have to take a breath and just read to make sure we can address it.
Oh, and the person who put it out has left.
Oh no. But I think it's also specific to their situation, so we can follow up with them.
Yeah. I do know I gave either my own email out or directed a bunch of people to send things to ROCS because there's a lot that we want to make sure we tackle on a more personalized basis.
Yep. So it is 10:12. We have until 10:15. We'll keep an eye for any last minute questions, but I would like to say thank you everybody for joining us. This webinar will be posted, this webinar will be posted on group site. It will be recorded. I wanted to make sure to provide that because all past webinars are posted on group site in English and in Spanish. We've provided the link here. And if you go to group site and you click the training section, you will find them. So please feel free to listen to past webinars, or after this one, you can review it or share it with your colleagues. We work really hard to bring you up-to-date, timely information and provide lots of time for question and answer. So we hope it's been helpful today. You know how to reach us for any follow-ups. And I want to say thank you to all of our subject matter experts for being here and contributing and being willing to answer questions live. So thanks, everyone. Any last minute comments from our organizers before we end the webinar?
I just want to thank you, Deanna, for all of your work on this webinar series. I feel like you just thanked everyone else, but you deserve the kudos as well.
It takes a village, Jessica. You know that.
And of course, in the end, what it really takes is you all doing this excellent work of bringing these topics and these questions to us. So don't be shy about bringing us things you want to learn more about. And we really thank you for your engagement.
We are honored that you are part of our village and we're part of yours. So have a great Wednesday, everybody. And take care until next month or until next time we talk.
Bye, all.